Hi, my name is Dr. Amir. I'm the medical director and owner of Dr. Amir's Weight Loss. I have Cynthia here with us, who's a patient. Hi, Cynthia.
Hi.
I know you've been with us for a few months now, and wanted to ask you some questions about your experience.
Yep.
What made you choose this practice as opposed to other weight loss clinics?
So I wanted a practice that was more in line with what I wanted, which was someone that will help me eat better, make better choices, and not kind of just give me a fast, quick method that would die with all trends. So I wanted someone who I trusted. I've actually had her as a primary care doctor, and she was very good at every aspect. So when she went into this sector, I immediately said, oh my gosh, let me see how she could help me with trying to lose weight. And, just because I had that experience with her in her other practice, it was just like she goes top to bottom on finding out health history and your history overall to kind of figure out what methods were the best. And it's what I needed. Where other doctors, I feel like it was more like, oh, okay, this is the trend right now. This is the hottest, medication. Here, go. But who wants to continually pump medications into their body if they don't need to? And as a healthcare specialist, I know the dangers that come along with that. So I wanted someone that had a program and had a way to cater it to my lifestyle. And so that's why I chose here.
Thank you, Cynthia. We do offer customized plans depending on the person's health preference, food preference, other medications that they may be taking. It's not a one-size-fits-all approach. Did you find that type of care in our practice?
Yes. So I was able to, say these are the foods that I like to eat, and she was able to incorporate that into the meal plan.
I understand. Do you have, I know that you have experience, we have a smart scale and an app that you're able to communicate with the office, especially directly with me.
Yes.
How does it feel to be able to just send your doctor a message and respond?
I needed that. I needed the accountability. I think it's different when, you have someone that could, when you get on the scale, she can see the numbers. So, it's so important to kind of have that person to kind of hold you accountable. And so I needed that. And I'm able to message at any time, and she responds quickly and responds with solutions, doesn't just listen and say, oh, okay, well, keep trying. No, she gives you solutions. Well, let's try this. And I found that extremely helpful because I know I need that, so I prefer that so much. And that's kind of one of the biggest highlights as well. Like, I love every aspect of this program, which is why I'm doing this video. It's really working for me.
Wanted to get your opinion. I know that you had some people that that were, the big hype right now is the injections, which can be very effective for a lot of patients, but we are finding that there are, being misused in some places, and safety is also an issue. I know that you did a lot of research before coming here and tried various programs. How does this differentiate from those things you've tried in the past?
Well, I mean, to be honest, I have friends that are on these quick weight loss things, injections, and once the injections are over, that's it. Like, they eat back to what they were eating. They actually never knew how to eat. So they were just losing this weight, and that's not how I wanted to do it. And I think, there are complications with that. I feel like I remember the whole theory when COVID was a thing and people didn't want those injections, but now this is promising you weight loss and everyone wants to jump on it. So it's like, I really feel like it's almost better because, again, some people go through nutrition and they hear how you have to eat, but they actually don't do it. And so I feel like getting into a program with this much structure helps you to kind of figure out, okay, this is what I need to eat versus getting this injection. And of course, for women who are in childbearing ages, you also want to consider that too, because when you're on these medications, that's another thing that you have to think about. And there are complications that people have been having that are not out there. And that's people having gastric issues with severe constipation. So you got to think about all of those different things. And I feel like, because I do research before I jump into anything, I looked at that and I saw that this program, again, she's going to work with you. If you come to that point where you need something like that, she's an MD, which, could help you out with that. But again, I feel like you have to think about, what you're going to eat and what you're putting into your body. And I think that's the biggest issue, because these injections, who wants to inject themselves for the rest of their lives? So,
Cynthia, what do you do for work?
I'm ICU nurse.
Okay, ICU nurse. So you've seen and you've met different doctors, you've seen
Yes.
different things, and you have the healthcare experience.
Yes.
So really, your opinion really, it comes with a lot of respect, because I know you've seen it all and maybe even done a lot of it.
Yeah, as a travel nurse, yeah, I've seen it
past.
all. Mm-hmm.
Okay. My other question to you is, where do you see yourself a year from now? Are you ever going to go back to that weight? Those habits that you had before?
Never.
Okay.
Never. Even on the days that I would have a meal that, one would consider a cheat meal, because I don't have cheat days, I have a cheat meal. Even during those days, because of the way that I've been eating, I feel the difference. I'm like, oh, wow, that was kind of heavy for me. Like, I felt it. So this also teaches you portion control. And I feel like that's a weakness for a lot of people, and even a lot of my friends, where it's like you kind of overeat. You think you need this amount of food, but you really don't. And I think it's in your mind that, okay, I have to eat this whole plate, and you really don't. So, in the years from now, I will never go back to the weight. You'll see the before and after pictures. I will never go back to that weight again. And, sometimes, when you're working, I work a lot. You can get caught up in work and you don't have time to work out. And that's another big thing, because I rarely worked out with how I'm eating. So it's really what you eat. Again, you can work out. Workout is going to help give you that extra boost and will help you tone your muscles. But it's really what you're eating. People have told me that, but you don't want to hear that, because you want to eat what you want to eat. But it's really what I ate. So I'll never go back to that weight again. I was uncomfortable.
So I know that you have tried some of our meal replacement products, and you like them very much.
They're so good.
We use New Direction, which is an elite product line that's used by top institutions. The nice thing is they're very portable, easy, and you don't need to have 5 servings a day to stay on track, and they can be used as 1 meal, 2 meals, or 3 meals, even 4 meals, depending on the person's goals and weight and height. And you enjoy the products.
Very much so. I'm very picky. So when it comes to food, like, I was so happy that I actually liked it. And at work, sometimes, I start pretty early. I'll have a shake, and some of the shakes come either in a packet or like in a bottle. And I'd honestly just bring my water, get some ice, and I'd shake it up. And as I'm charting or as I'm moving around, I just have it really quick, and it keeps me full. So that was important to me, because I do not have the luxury to sit down and have a breakfast. So this is great for on the go.
So busy professional life.
Very.
Easy.
Yeah.
And as far as hunger goes, do you feel that the program allows you to feel fulfilled as far as hunger goes?
It does. It's thick. Some of them are thick, and I feel like even in the bottle, there's a water measurement where you could put how much water you put in it. And obviously, the less water you put, the thicker it is. And it gets pretty thick if you just let it sit for a little bit. That is fulfilling. And again, I burn a lot of energy while I'm working because of the high intensity of my career. So it keeps me full. So I never feel crazy, like by the end of the day, like, oh my gosh, I didn't eat anything. So I don't have that feeling.
My other question is, sometimes in plans, like you mentioned, you may have a cheat meal,
Mm-hmm.
or maybe you had a bad day or weekend. How you react to it now as in the past? Does it put you in a bad place where you feel frustrated and drop off, or you just pick yourself back up and continue in the habits that you've created?
I actually pick right back up. And the reason why is because first, it didn't feel good to eat the meal. It might have tasted good, but it didn't feel good, because I'm like, man, this kind of hurts my stomach a little bit because I haven't been eating this kind of food. But, I end up picking right back up because this is what is working. So it's almost like, okay, all right, I'm going to go back to my stricter way of eating. But if it's working for me, then why would I leave it and continue to eat those type of food? Those foods will always be there. And they will always be there for that cheat meal. But honestly, when you put that in your mind, like, okay, this pizza is going to be there because that was my weakness. But when I say, okay, I'm going to go back to the way that I was eating because this is what works, you feel good to go back. You won't feel like, oh my gosh, I had a cheat meal, I can't do this again. No, you won't feel like that because the results will speak for itself.
Would you feel comfortable sharing your progress of how, I know that you were, just like many of our patients, have lost unhealthy weight only, have not lost any muscle, but have lost unhealthy weight?
Yes, I lost over 20 pounds.
Of?
Fat.
You want to show them what fat looks like?
Oh my gosh.
So this is 5 pounds of fat. How many of these did you lose?
Oh my God. I lost 5 of these, basically. 25 pounds I've lost. And
wow.
This is 5 pounds. Like, it's crazy because I don't even know, where was this stuff? Like, you don't realize how bad it is until you actually look at it.
So, and how long have you been with us?
I haven't.
May.
May.
So you've lost 25 pounds of
fat, of good, like the weight that you want to lose around your organs. I was even breathing different. Like I felt like when people around me, they could hear me breathe. Like
so the difference between our program, we ensure that you lose unhealthy weight. There are a lot of crash diets where somebody will lose, 3 to 5 pounds a week. Usually it's 50% will be muscle. Especially in women who are perimenopausal, that leads to bone loss, and oftentimes you cannot regain it back. So, once you lose bone and you're late 40s, early 50s, it's a precursor to osteoporosis or already set in. So, with our patients, we ensure that they lose unhealthy weight, they maintain their muscle mass, they remain strong. It's never about I have to be a certain size or a certain weight. It's about where does your body get to a healthy weight and what are our goals? And we adjust the goals based on the person, never a one size fits all.
That's true.
And always making sure their well-being is addressed first, and if they have any hang-ups along the way, we address them. And as she mentioned, she uses the app to message me. I'm able to respond and address any issues because she's been away as a travel nurse. So,
yes.
We do a lot of remote care as well.
Mm-hmm.
And it always feels like you're right in my office
yes.
when I talk to you. It doesn't feel like you're away. So
right.
it allows me to troubleshoot any concerns that you have along the way.
Yep.
So I look forward to the next step in your health. And as we get close to the end of the year, I think we're going to reach another big milestone.
Yes.
And I can't wait.
Yes, and I cannot wait for you guys to see the before and after. You are going to be shocked. So good luck to you guys.
Thank you, Cynthia.
My pleasure.